Good evening and welcome to the UP Community Health Town Hall program. My name is Elise Burr and I am the director of the Northern Michigan University Center for Rural Health. Joining me tonight as co-host once again for the program is Dr. Kelly Kam, epidemiologist and assistant professor in the Department of Kinesiology and Integrative Physiology at Michigan Technological University. Our topic this evening is direct care workers and caregiving, a really important topic and an area right now that is truly being developed more at the state and national level. I'd like you to join me in welcoming this evening's guests. Originally, we thought we would have Eric Pad, founder and president of Caregiver Incentive Project, on with us tonight, but filling in for him will be Heather Peacock. She's the Grant and Development Advisor at Caregiver Incentive Project here in Marquette. Also joining us tonight is Dr. Claire Luz. She is the Director of Impart Alliance and the College of Osteopathic Medicine at Michigan State University. Shanae Krebs, she is also a local person here in Marquette who is currently a direct care worker and working in the field of private duty as a caregiver. And lastly, we have Timothy Nielsenga. He is a senior program officer for the Healthy Aging and Caregiving sector at the Michigan Health Endowment Fund in Lansing. So thank you, everyone. Kelly, would you like to get us started with some statistics and definitions so that we all understand what we're talking about tonight?
Sure. So I'm excited to join this one. It's quite relevant to many of us. I actually found a quote from the late Rosalind Carter that said there are four kinds of people in this world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. Caregiving is universal. And as I was exploring this topic to try and get an understanding for myself that I can share with everyone, I found that really quite a moving and powerful statement, and really quite true. And I'm sure everyone on our panel tonight will absolutely agree that how true that is. The one thing that I really did find here is that caregiving can be a really diverse term. And because it's a diverse term, then trying to get numbers, and in my world of having as valid of numbers as we can have, it gets really hard when we have a hard time defining what it actually is. So what I have found through a couple of different organizations and with some assistance of some of the panelists that we have on tonight, that there is kind of broadly two different areas of caregiving. And when we talk about caregiving, we're talking about caring for older adults or anybody of any age with a disability. And there's kind of two main groups, one that's the more informal and ones that are more of the formalized or direct caregivers. And so any of the caregiving can be short-term or it can be long-term, and they can deal with a variety of different kinds of work. So it can be things like assisting people with daily living and the activities of just taking care of ourselves. It can be a little broader, looking at activities around being able to continue to live in your home. So maybe assistance with transportation, or assistance with cooking meals or grocery shopping, or even making sure that your medication is on track for what it's supposed to be. It can address companionship, and as the recent Surgeon General's report showed, how important loneliness is to our health, and addressing loneliness to improving our health. And then can also really look and be aware of any signs that someone's needing more assistance, and looking at some of those. Certainly the direct care workers absolutely have that, can have that medical training. I mentioned there's these two major different groups. So one is more of what we consider of an informal caregiving, and these are often family, friends, whether it's family by choice or family by blood, that are helping take care of each other, oftentimes in homes. And one of the estimates that I found for that was that about 1 in 5, or 53 million Americans, currently are taking care of someone or were in the past year. And these numbers are rising since previous estimates. And one thing that I really found was surprising was an estimated 1.3 to 1.4 million children ages 8 to 18 were also part of that group of informal caregivers that are caring for older adults or those with disabilities. And that was really, really surprising to me when you think about some of these either very young kids or kids trying to balance working and caring for family members as well. On the more paid side of care, we've got direct care workers, like one of our panelists here. I did find an estimate of 4.7 million direct care workers, and they can be providing care in homes and community settings or in residence care or long-term facilities as well. And that again is a very broad group of workers. It's a very broad term to be able to use that. So specific job descriptions and specific job titles are very different within that group. Particularly within these direct care workers, they are overwhelmingly female, many people of color, and often middle-aged as well. So middle-aged women that are disproportionately people of color. And I'm sure, as our panelists can attest to this, there are certainly some great fulfilling benefits to being a caregiver, but particularly for the informal caregivers, there's concern about the financial strain as well as health impacts on the caregiver themselves. So I'm really excited tonight to hear from all of our panelists. And we're going to start off tonight with, hold on a second here, I've lost our list here, with Heather Peacock. So I welcome Heather, and I'll let you take it away.
Thank you, Dr. Cam. Well, I'm happy to be here, and Eric Pad, the founder and president of the Caregiver Incentive Project, wasn't able to be here today, but I'm happy to share a little bit of information regarding the organization. If I should jump right in, does that sound good?
Yeah, go ahead, Heather.
So the Caregiver Incentive Project was started in 2018 by Eric Pad, who I mentioned earlier. He himself and his wife saw it every day. They, as parents of a child with disabilities who's now an adult, they experience firsthand the challenges and the rewards of being a family caregiver, as well as having to find qualified care for their daughter. And so through that process, they saw a need to improve the system and help others. And they looked around at their neighbors and saw there were many people like them who needed supports and help. And coming to the UP and meeting like-minded folks, they saw the need to develop the Caregiver Incentive Project. And its mission is focusing on improving the lives of the cared for by supporting the caregiver. So realizing that caregivers themselves need a voice, and we need to understand their needs and the barriers they face in order to provide the quality care that individuals need in all these settings. So it's I myself got involved in CIP. I think it was in 2019. Eric came to me, and if you've met him already, he's a very inspiring person, and they're big shoes to fill, figuratively and literally today. But he inspired me by sharing his story. And as a family caregiver myself, of a family member with a life-limiting diagnosis and a parent with a closed head injury, I really understood intimately the issues he was sharing with regard to worrying and wanting to have confidence someday that when he and his wife could no longer be there, that there would be help available for his daughter. And so here we are working today to find like-minded people to work on this issue. And we've connected with Impart Alliance and the NMU Center for Rural Health and the Michigan Health Endowment Fund, who's been extremely supportive through this recent grant we've been working on to increase awareness of the caregiver shortage and look at strategies that we in the UP in a rural community could dig in and be a critical part of what's happening at the state level to enhance this whole focus on direct care workers. So
I think it's
excited
kind
to
of
be
unique
part of it.
because, I mean, that's the joy of being in the Upper Peninsula, right? It doesn't take much to make a big impact because there's only so many people up here. And so when we really join forces, it really can move things forward. So you worked with Eric when he initially thought about applying for this most recent grant. Can you talk a little bit about that, Heather?
Sure. Well, as we were, looking at the issue and thinking about how we were going to bring people together and really dig in to look at these issues, we had this great opportunity where we'd been in very close discussions with the Michigan Health Endowment Fund talking about aging related issues. And the opportunity presented itself for us to apply for a grant, and we received the funding, and the intent of the project is to widen the pipeline of direct care workers. And so how we worked to achieve that was by creating actually pulling stakeholders together and getting information, developing a matrix of how to contact people, because it's a very complex process. We realized that it's not easy to find out who to talk to and how best to communicate to folks. Creating an orientation that could be an informational orientation to educate people about what the roles and responsibilities are as direct care workers and where the different settings they can work in, as well as training opportunities and other things. And then looking at developing a self-assessment tool so people could decide for themselves, is this a good fit for them? And then work together as an advisory group to come up with processes that we could direct people to helpful training and resources to help them be successful in their path, and whether they choose to look at direct care work as a career path or part-time work that they could do. Because up until this point, there really hasn't been a really universal definition, as Dr. Cam said, and there hasn't been a recognition for direct care workers for being a critical part of the healthcare forefront. And they are essential workers every day, working unseen often in settings, especially the home, where they're providing critical care to people, allowing them to not only meet their basic needs, but they're a critical part of helping people live their best lives.
Yeah, well said.
We dove in.
So let me ask you this question. This grant had worked on developing some orientations and how to educate people about caregiving. Where can people go to learn more about the education and the training programs that are being made available in the region?
Well, first and foremost, we have some orientations that are coming up that we're offering across the Central UP, which we're excited will be part of something that we'll be able to use statewide once we finish this grant project. So it's exciting to be a part of that. Also, you can go to the caregiverincentiveproject.org website, and there's also resources through Impart Alliance and a handful of other organizations that are offering trainings. We're working in a lot of different areas to develop both in-person and virtual different training opportunities. And not only are those training opportunities important, but it's also critical that, we have these processes in place to mentor people and then look at what barriers they might encounter, like, is transportation an issue? Is childcare an issue? Is education that issue to go to those different training programs? So we're hoping to help people find the right programs that will work for them and with their schedule, and help set them off on the path to success. And I'm sure Dr. Luz will share some more information about the Impart Alliance website and stuff.
What do you think people can do to really support the crisis right now that's happening, with caregivers?
Well, like the quote said, we are all, if we're not already, we're going to be caregivers, or we're going to need care. So I think the first and foremost thing we can do is start talking about the issue. Talk about the crisis, look around, look at your neighbors, and realize that there are many of us, almost all of us, that are in some way touched by this issue. And then start having conversations, talk with each other. Talk with your representatives, talk with different agencies and community organizations that you encounter about this issue. We can work together to help address the shortage of caregivers. And also, if you see a caregiver, you find out somebody is a caregiver, thank them and start to think about the fact of how critical they are. Just as you would get excited about meeting somebody and hearing about their experience as a nurse or a doctor or respiratory therapist or any other healthcare profession, and you find it interesting, think about the impact that these direct care workers have on people's lives. And I think that's important. And then there's also the opportunity to volunteer for organizations like ours and to, give back and donate if you can. But I think first and foremost, we have to recognize this and see this as a career path and a valued part of the healthcare system.
Yeah, you're absolutely right. With the current grant that Caregiver Incentive Project has right now, can you talk a little bit about the core goals of the grant?
Sure. The primary goal, as I mentioned, is really to widen the pipeline of direct care workers. And as we sat down and looked at this issue a little bit more intimately as a group, we realized that there were some key populations that we could really lean into to look at to try to increase participation and exploration of careers in direct care. And right now we're focusing on individuals who are unemployed or underemployed. And we're finding from our recent orientation that retirees could be in there too. And also high school students or those who are, early into college, individuals who have served in the military or their family members, and also tribal community members, many of which are providing care to a loved one in their home. So we are really focusing on trying to widen the pipeline of caregivers in some non-traditional settings, and to look at putting together these tools of this orientation, self-assessment, and then the training and process by which to help people to find resources to be successful. So
wonderful. Thank you, Heather. We appreciate all that insight and everything that you're doing, to work and support with Caregiver Incentive Project.
Happy to be here today.
So for listeners just joining us, this is the UP Community Health Town Hall program. And the topic this evening is direct care workers and caregiving. And we'd like to welcome Shanae Krebs as our next guest panelist. Shanae is a direct care worker herself in private duty. She's going to talk a little bit about why she chose to become a direct care worker, what her role is, her responsibilities, and what she really enjoys about her position. So welcome, Shanae.
Hi, glad to be here. So I became a direct care worker about 3 years ago. During the height of COVID, I noticed, just like a lot of people did, how assisted living homes and group homes and places like that were really hurting. Caregivers still had to come in, people were getting sick. So I just wanted to help in that way. I really felt, I've also seen this go through my family too, my great grandma with dementia. So I just wanted to help in that way. And then I turned out to love it, and I have turned out to stick with it this whole time. I transitioned from a assisted living home for people with dementia to a group home with people with disabilities. And now I also care for an individual in her own home overnight. So I've had a good variety of caregiving experience. I've loved every place that I've worked, and I've really enjoyed the work that I do. It's really fulfilling, wonderful work, and I've made a lot of really great relationships. Most of my roles and responsibilities have been the activities of daily living and instrumental activities of daily living, like Dr. Cam's talked about. So bathing, morning routines, eating, stuff like that. That's a necessary part of your life. And then also transportation, grocery shopping, that kind of thing too. That's different at each of the homes that I've worked at. So the person that I care for overnight, I don't have to do as many of those things. It's more just when she tells me to do something, I do it. It's each job has had its different variety for sure. Like I said, I really like the relationships that I've made with the people that I care for. You're doing really personal work, and you really get to know the person. You get to know what makes them happy, what they don't like, how to help them have a good day, how to help them reach their goals. So that's been my favorite part about the job. And I've seen that in all the different places that I've worked. That's been consistent.
So Shanae, you've helped out a little bit with this grant project as well. Can you talk a little bit about what your role has been with Caregiver Incentive Project in particular?
Yeah, so like I said, I've been a direct care worker for a long time, and I was also getting my bachelor's degree in social work. And so for my field placement, I interned with the Caregiver Incentive Project. And then following my internship, when I graduated, I continued my job with them as the project manager. And so I've been involved with the orientation process mostly, so creating the presentation for people. And I actually delivered the first one the other day. It went really well. We had a few people there who were really excited to learn about caregiving, and it went really well. So that's been my involvement. I've been involved with a few other things at the Caregiver Incentive Project, a few other projects we've worked on, workshops in the academies that we've held. And all of it has just been really great work for me in my career too, as a direct care worker and as a future social worker.
So right before the program started, we were catching up a little bit, and you were telling us about a recent informational session that you held. Can you share a little bit about that and what you might have coming up?
Yeah, so the informational sessions are about a half-hour presentation where I talk about just the basics of caregiving, where you could work, what you might do, answer any questions people might have, because it's kind of a confusing job that not a lot of people really know what you're kind of getting into. So we just want to help as many people become caregivers as we can by just explaining what you might be getting into. So after the presentation, we have question and answer. It was just really conversational, informal. We had food provided, and it ended up being about an hour and a half. But we have another one coming up next week. And then there'll be and that one's in Manistee, and then in a month or so, we'll have one in Marquette too. So.
And where can people go to learn more information about where and when those are taking place?
The Caregiver Incentive Project website has its own caregiver pipeline tab that should explain everything. And all of our contact information is on there too. You can reach out to any of us. We'd be happy to help.
Great. Shanae, any other advice that you might have for college age students or young people who might be considering caregiving for others while they're still in school?
Yeah, this job has really been great for me as a college student. It's very flexible. A lot of, especially in home care, they're really willing to work with whatever hours you can make work. Even in like a group home setting or something like that, you might become an activities person and come in for a couple hours to help out with activities or something like that. So really, this job has been super flexible, and I've also gained a lot of great skills. Like I said, as a social worker, you have to learn to work with all different groups, regardless of what kind of day somebody's having or what kind of day you're having. You have to be consistent and calm and kind. And that's what you're going to learn from being a direct care worker. But this is also applicable to a lot of different careers. So I would just highly encourage anybody who's even thinking about it to look into it, because it's really just improved my life a lot and improved my outlook on a lot of different things that I got a viewpoint that I would have never gotten otherwise.
And look at all the great people you've got to meet and work with.
That too. Yes.
Something to be said for that. Well, thank you, Shanae. We appreciate it. I'm glad we could have you on tonight.
Thank you.
So Dr. Claire Lutz, she is the director of Impart Alliance and College of Osteopathic Medicine at MSU. And Dr. Lutz has been working on caregiving for quite some time in the state. And she has some wonderful, exciting information to share with us tonight. She's going to talk about what is happening at the state level right now. And there's been a lot of movement more recently. She's also going to talk more about the profession itself. So thank you, Dr. Lutz, for joining us tonight.
Yeah, absolutely. Thanks for having me. And thanks for the listeners. I'm assuming that since you're on this call, the caregiving has touched you personally, as it has all of us on the call. So I am a gerontologist. I'm on faculty in the College of Osteopathic Medicine at MSU, the director of 2 programs, but I started out as a direct care worker and then did about 20 years as a social worker. So we have a number of social workers on the call. The majority of my research over the last 2 decades has been on the direct care workforce. It's near and dear to my heart. The organization, I also direct 2 different programs. The organization that brings me here tonight is called Impart Alliance, which was established in part by a generous grant from the Michigan Health Endowment Fund. So I'd like to give a nod to my colleague, Tim Niasanga, on the call there. Impart's primary goal is really to help the state of Michigan expand and support the paid direct care workforce. We do have our own training programs, which we've been developing for about 15 years now. But we also do a lot of advocacy at the state level for policy reforms to improve I'll talk about the strategies for addressing a shortage, a major shortage we're having right now. So the majority of care is provided by family members. This is true, often in their own private homes, but families often can't do it alone for many, many reasons. And when families need help due to work or other obligations, such as caring for young children or other people, or their own health conditions, or the need for respite, or the cost of it, and so forth, they often turn to paid care. And up to 80% of paid care is provided by direct care workers. And as Dr. Cam was talking about earlier, they go by many, many names: direct support professionals, home health aides, certified nursing assistants, personal care aides, and on and on and on. So I am using the term direct care worker as a general term that refers to individuals who provide the essential supports and services that Dr. Cam and Shanae all described better than I could. So they are providing these services to individuals with disabilities of all ages and older adults, and they're doing it through the behavioral health system, the community mental health system, home and community-based services, long-term care programs and organizations. And then they're also doing it for private pay on their own, where their employer is the person needing supports and services. So they work across the board, all different settings: private homes, assisted living facilities, group homes, nursing homes, community living support settings. So they do have a number of things in common, which Shanae and Dr. Cam alluded to, with the activities of daily living, like bathing and transferring and going to the bathroom, and then some of the independent daily living chores we all have, like shopping and housekeeping and cooking. But they do a lot of other things as well. So it becomes, we try to do a lot of advocacy for policy reforms. It's really hard to do when everybody has a different definition of what a direct care worker is. So there's been a group of us over the last couple of years who have come together to really come up with a universal definition of direct care. And I covered most of it in that description I just gave you, but it makes a huge difference to be able to go to policymakers and we're all saying the same thing. We're calling direct care workers the same thing. We're coming with consistent messaging. It makes a huge difference. So that was really important for us to do before we started to do anything else. The problem is right now that there is a critical shortage of direct care workers, just as there is a growing shortage of family caregivers, which is one reason why, Dr. Cam alluded to this earlier, but with the shortage of family caregivers, families are sort of reaching down into younger and younger generations to help fill that need. The Health Endowment Fund actually did fund a study that we've just completed on college age caregivers and the challenges that they face when they're juggling really two, major things in their life. They're trying to get a degree and be a primary caregiver at the same time. It's not easy. So we need more direct care workers. It's estimated that in Michigan alone, we need about 36,000 more direct care workers than we currently have. And we don't want just warm bodies. We want people who are competent, who are going to, provide good, competent care and be kind to the person and value their preferences and get to know them, like Shanae was talking about, get to know what their preferences are and then honor those. So we need people who are qualified to do the job. And it's not just about the numbers. There's just an astronomical turnover rate as well. It can be as high as 85% for a lot of employers, which is astronomical. It keeps the system all turned up. It's very expensive. So I'm here. Elise reminded me that I am here to deliver a ray of hope tonight. There are many, many wonderful initiatives right now taking place at the state level to address this shortage. And I am the co-chair of the statewide advisory direct care worker advisory committee and the statewide direct care worker coalition. And I have honestly never been more hopeful than I have ever been in my 40 years of advocacy than I am right now. It's an exciting time to be part of this. We were talking about this earlier. The primary way to address this shortage really is to make sure that direct care workers have economic security and respect. And our strategies are loosely divided into three major categories: getting them higher wages and benefits, which is kind of a no-brainer. Professionalizing this workforce, and by that I mean establishing some competency standards, some training guidelines, some credentials, some career pathways, and then culture change. And so that we can become a society who places a lot higher value on caregivers of all kinds, informal or formal, paid or unpaid. So to give you just a very brief list of examples of progress that we're making in these areas, we have developed basic direct care worker core competency guidelines, 15 of them, that were adopted by the Michigan Department of Health and Human Services last year. And this was a very critical first step to professionalizing this workforce. You can't design training programs if you don't even know what competencies we're training to. So we can now wrap training requirements, credentials, career pathways around these competencies, which is going to make the job far more enticing, and it should lead to better recruitment, retention, and higher wages. We have come up with a common working definition of the term direct care worker, which I mentioned earlier. We've had a work group meeting for 2 years to compile best practices that have been recommended here in Michigan, but also across the entire country. And we have just submitted 14 key recommendations to Michigan Department of Health and Human Services, and we are standing ready to implement all of these recommendations and hoping that they will adopt those very soon. So Impart Alliance has now received substantial funding from the state to establish a statewide direct care career center, which is super exciting. And we are just ramping up now. We're going to have a training arm, a credentialing arm, continue on with our advocacy work. One of the things we really want to develop is something that Heather was talking about earlier, and that is a career success model, because we do know that you can't just train somebody and plop them in a job and say, see you later, good luck. You know, it's just not going to work. So a lot of the people entering the field are on the economic edge, and they need support. So programs like what the CIP is putting together are crucial. You know, we need to help people understand what this profession is all about, help them decide if they want to get into it or not. If they do, help them find the right training and get competent, find out what the barriers are, whether it's tuition assistance or childcare or transportation, help them remove those barriers, help them find a job, and then help their employer retain them by treating them well, so that they want to stay on and with higher wages and respect. So that we're calling that the career success model. I'm super excited, and I'm really hoping one of the things we can do is to continue to work with the CIP to take what they're doing right now and scale, you know, add to it so we have a complete success model and then scale it up across the entire state. That's one of our big goals. So I think we're going to see some really good changes in the year ahead. I'm excited about it. I'm trusting that it will help relieve the shortage of caregivers that many of you have or are experiencing right now. And I think I'll stop right there.
Oh,
And
you're fine. You're on a roll. I mean, this is
yeah,
this is terrific.
all of us could keep going on and on about this.
I know it's such an important topic, and so it made me think of a couple things. One thing I thought about was, I think in the last needs assessment, the statistic, Kelly, I'm sure will correct me if I'm wrong on this, but it was something like 30% of people in the UP that are age 65 and older are currently living alone. And so that made me think about the people who are trying to independently live on their own, and who's keeping an eye on them, or who do they go to if they need help, and checking on neighbors. And that kind of like crosses my mind a little bit. It also made me think about the time I think a lot of people in their life realize there's somebody that might need care, and then how do they address that? There was a time when my mother needed care, but I was 6 hours away. And so my brothers and I were trying to figure out, what are we going to do, because nobody lived where my mother, resided at the time. And so that kind of became the focal point at that moment in my life, was just, okay, how do we do this? And my brother even offered to stay at home with her. And I thought, well, that's great. You can be there, but are you equipped to be able to meet the needs that she's going to have? And so all of this is very near and dear, I'm sure, to a lot of people that are listening to this. Kelly, you want to ask a couple questions?
I did, because this also brought up several questions for me thinking about this. My parents are also far away, and nobody lives in the town that they do as well. But it started me thinking, you mentioned that there's now some standards and some competencies in Michigan. What if if I'm helping family members that are out of state, are there competencies federally? Are other states working towards that? What would I be able to do if I'm trying to find a direct care worker? Are there, even within Michigan, I would assume I can now look at to ask about their training program, and find out, kind of dig into their training program if they met the Michigan competencies. But for someone looking out of state in Wisconsin or Minnesota, what options do we have to find that the care we're hiring is qualified and safe and respectful and all those things that you mentioned?
Yeah, it's a great question. I can speak to Michigan. I do know a little, it varies from state to state. I do know a little bit about other states, but I'll use Michigan as an example. So the certified nursing assistants are required by federal law and state law to have at least 75 hours of training. And nursing homes are required by federal law to hire direct care workers that are certified nursing assistants. And then there are some other types of direct care workers that can get certified through a community college program, for example, but there's no state certification for them, like home health aides. And there are a few others that are required, have required training, but it does shock people to know that for the majority of direct care workers, there are no federal competency or training requirements, zero. A lot of the requirements are either done at the state level or at the agency level. So some agencies have really wonderful training programs, others do not. There's a range of quality. Some of the statewide programs have extensive training requirements, like through the community mental health system, but they don't have a credential associated with that. And then there are other programs that require very little. So you have to kind of, dig deep and talk to people who know about the differences between these programs. And if you're going to the individual agencies, ask them, what are their training requirements for the direct care workers that they hire? What do they cover? One of the things that we are doing in Michigan is at the state level is we're developing 4 new levels of or types of direct care workers, and these are stackable. And so they will take you like from being from a companion all the way through to somebody who can do all of the hands-on personal care 24/7 at end of life. And what's different about these levels that we are developing is that they do all align with the new 15 competencies that the state has just adopted. So we're really hopeful that at some point in time, these will be credentialed. When people see these credentials, they will know that these workers have passed competency tests, assessments, and are capable of doing the job that they've been hired to do. Now, I don't know of too many states that have statewide competency guidelines. I think we are one of the few. Actually, Michigan, we should feel proud here. We're, there are some very progressive states working hard on this issue, and Michigan is right up there with them. So I hope that helps answer your question.
It absolutely does. So everybody has to move to Michigan, and we'll keep our
There
my
you
parents
go.
here. I did one other question that I had with the 36,000 jobs of shortage. Is it like most other things where rural areas have more shortages than urban areas? Or is this, I would assume it's across the board, everybody's got shortages. Are they worse in rural areas?
The rural areas, the UP faces some different challenges than downstate. These shortages are across the board. Every state in the nation is experiencing them. Every place in Michigan is experiencing them. We have different challenges. There are a lot of places in the northern part of the lower peninsula that are quite rural, or where you have to travel long distances to get to somebody. Some of the challenges up in the UP. So I actually got a fellowship one year to interview direct care workers across the entire state, 30 of them. And we went with I traveled with a photographer, interviewed them, and I interviewed a number of them up in the UP. And some of the conditions that were unique to the UP were, first of all, weather, snow, lots and lots of snow, long distances that you'd have to travel. I'll never forget one person I interviewed who was determined. It had just been a blizzard. The roads were all shut down. Her client was about 5 miles in. There was no access. She was determined to get to her, and she walked. And I said, "Oh my gosh, how did you do that?" And her simple response was, "I have really good boots." You have some people have snowshoed in, snowmobiled in. You won't see that down, near Detroit. But the urban areas have problems as well in terms of mass transit and transportation and ability to get, to get to their clients as well. Again, a lot of these workers are living on the edge economically. They may not have transportation. They may not have gas money. So there are other challenges.
So I think back to about maybe 3.5 years ago, Claire, is when I first reached out to you. And who knew we'd be where we are today right now, with
Right.
caregiving and all the developments that have been made more recently. I really think it's unique that there's been relationships built to really strengthen what's happening in this profession and non-profession to some extent. Can you talk a little bit about how you've engaged with the agencies in the UP? And sometimes UPers are threatened, when somebody from out of the area, comes in. But I think you've demonstrated collaboration and grace, and that the working relationships that you have with agencies and people really shows what can happen, when people come together.
Yeah, thanks, Elise. I appreciate that. One of the things we have learned with all of these successes we're starting to rack up, there are some, with lessons learned about how to be successful. And one of the biggest ones we have learned is that you have to have statewide coordinated leadership built on relationships that are built on trust and over time. And Tim knows this. Everybody on the call, I think, knows this. I've been working in this with a lot of people, both in state government and across the entire state for 20 years, developing these relationships through grant projects, through all kinds of projects. And I just feel so fortunate. I'm privileged to be working with all of these people across the state, the UP included. We've made some tremendous relationships up in the UP. We can't do this alone. it is all, and it has to be done through relationships that are inclusive, that where everybody hears their voice. We started a coalition, statewide coalition a few years ago. We started out with about 50 people, individuals. There are now about 1,300 people on this list, a lot of them in the UP. And one of the beautiful things about a coalition is you build these relationships and you can mobilize people quickly. When there's an advocacy alert, when the direct care workers are facing, a potential wage increase from the legislature, and they need to hear from everybody, right? And they need to hear the same message from everybody. So this relationship with the CIP has been fabulous, and I'm privileged, honestly, to be working with these people here and hoping that we can, scale it up. But yeah, it is all about building relationships and trust and respect for each other, and it's not going to get done otherwise.
Can you tell us, Claire, where can people go to learn more about Impart Alliance?
So we have a brand new website, which I'm excited about, with a new URL, thanks in part to Heather, who's been doing a lot of work on it. And it is very simply www.impartalliance.msu.edu, or you can email us at impart@msu.edu. And I highly encourage everybody to get on that coalition email list. And we're, because of the grant that we got recently, we are able to build staff a little bit. And we're hoping to have regular newsletters going out through that coalition list that will keep people up to date on what's happening across the state, but also at the state level, and how they can get involved. We're going to start, and the advocacy alerts will go out through that as well. So I do encourage people to get a hold of that, to get on that mailing list. And it's called the EJEC, so don't let that trip you up. That stands for Essential Jobs, Essential Care. So the EJEC Coalition mailing list.
Thank you, Dr. Luz. We appreciate it.
Thank you. Thanks.
Tremendous work. And Heather, I also want to give a shout out to you because you've been able to really be a bridge, between efforts up here as well as downstate. And, you bring it close to home and make sure that we're all aware of developments and everything. And so, it takes a team, it takes many people to be able to move these things forward.
Happy to help.
So for listeners who might just be joining us, this is the UP Community Health Town Hall program, and tonight's topic is direct care workers and caregiving. And joining us as our last guest panelist is Tim Neosenga. And Tim is at the Michigan Health Endowment Fund and has been very passionate about this and has a lot to share with us from the Michigan Health Endowment Fund's perspective. Welcome, Tim.
Thank you, Elise. It is a pleasure to be here and to be a part of this esteemed panel. And oh my gosh, Claire, hearing you speak, I'm already fired up. Let's continue the great work you're doing, and others, and Heather and others. It's just great to learn and to just to be partners in this work. Our foundation exists to support older adults and kids, and but all this work can't, it can't happen without great partners like you. So it's a pleasure to be a part of this conversation.
Tim, can you talk a little bit about the challenges that might be occurring downstate that you've been engaged with, and how that compares to what's happening up here?
Yeah, I can speak a little bit to that, and part of my role at the Health Fund is to support initiatives that look to enhance the lives of older adults, and I lead specifically the work that supports direct care workforce and the family caregivers, so the formal side and the informal side. And so I'm very passionate about both. And as a former direct care worker, I have grappled with a lot of the sort of the issues that that we mentioned, have learned a lot, and really have grateful to have traveled that path to the position where I am now. And so, I mean, some of the issues we've had a chance to partner with a few organizations to kind of look at, like, statewide surveys and others. And we know that in general, currently with the family caregivers, Michigan has about 1.7 million family caregivers. And all those obviously have various needs, but specifically in the UP, there's an estimator of 160,000 family caregivers who have various needs, as Claire and others kind of talked about. And so those those family caregivers, and they have similar challenges as far as like isolation, lack of understanding of available resources, managing childcare while providing care, transportation issues, navigating and coordination, and really sort of having access to services. These are some of sort of what we see as some of the universal issues across the state of Michigan. But when it comes to the UP, we see those issues being significantly magnified, and exponentially challenges and barriers exist to whatever that issue is. As Claire alluded to, you have this sort of like what are some of these hidden barriers, whether it's the weather, the distance you have to travel to access a service, and that bring true challenges to how one can engage a service and the quality of service they are able to have. And so the way we go about supporting a community and empowering them to address those challenges is very, we try to sort of do a community-centered approach where we empower the community leaders, like the Caregiver Incentive Project, to say, hey, this is what the challenges are, and really empower them to sort of figure out how to resolve those issues. Because I live downstate. I obviously can't I cannot completely relate to the some of the challenges, especially weather-wise. You say snow, man. If it's 50 degrees, I still have my my puffy jacket on until it hits 70. So I'm a little bit of a pansy when it comes to to the weather stuff. So but for those who are living it, you can sort of are equipped to understand some of those challenges. So that's why we really want to approach the work with partners who are doing the work, and especially empower the community to continue to do the work.
Tim, I'm just curious, what got you interested in caregiving, personally, at the personal level?
Oh my gosh, that's how much time do we have? But
7 minutes.
All right. No, personally, like I mentioned, about would have been 9 years ago now, I had an unfortunate opportunity to care for my father. He's still with us, but he had a complication through a surgery where I had to be a strong advocate through health systems, connecting him to resources. And as Cheyenne and others are social workers here, as a social worker, we're supposed to be navigators, connecting individuals to resources, and that I had it figured out. But really, as I kind of dove deep and tried to help him navigate, connect to resources, whether it was skill care, it made me realize that a lot of some of these everyday challenges, that the people are facing. And so I was already a social worker, and also I went through college similar to Shane, as a direct care worker. That's how I got through college. That's how I supported my way through college as a direct care worker, and knowing that there's value in supporting people, and but also knowing that these are skills that I would later need as a social worker.
I think so many families are appreciative of caregivers as well, because circumstances can be very emotional.
Mm-hmm.
People feel guilty that they can't provide the care themselves, or that someone else has to be there, and it can be so emotional. And I think that caregivers' ability to be able to provide that care and remove some of the guilt and the feelings that people might be experiencing, allow them to really focus on other levels, of the relationship with those individuals. And I think that's so important.
Oh, it totally is, and really being, like the famous quote, "They're not all heroes wear capes" or whatever, but really the family caregivers are heroes. They are in direct care workforce also. Really they're the backbone of our healthcare system, whether we realize or not. I mean, Claire and others have done an incredible job of raising this conversation up to the system level. And I don't know if, for those who are listening, if you got a chance to listen at all last night to the State of the State address, even the governor recognizes the importance of the role the family caregivers are playing in our current in Michigan, and really with the proposal of a tax credit that will support that recognizes these sacrifices that are being made by family caregivers, really to really knowing that there are a lot of financial sacrifices that are often made. And so family caregivers empower and support the dignity of those that they care for, and you can't ask more than that out of a hero, I believe. The hallmark of a hero.
Tim, can you talk a little bit about upcoming funding opportunities that the Michigan Health Endowment Fund might have?
Yeah. Oh, this is one of my favorite parts. But once again, we're always looking for partners, in various parts of the state, especially in the UP. We are funding some work in the UP, but we're always trying to figure out how can we increase and invest into the lives of Michiganders. And so keep an eye out around May or June. We're going to be our Healthy Aging program is going to be releasing a request for proposals, basically look to improve the health and the lives of older adults. Here, give me a second real quick to kind of provide some of that information for you. And so part of what we're going to be looking for is, we have various priority areas. And sorry, my computer is freezing on me. Give me 2 seconds. And so, anyway, so those priority areas include improving the quality of the life of older adults, supporting a strong direct care workforce, preventing elder abuse and neglect, increasing respite opportunities for caregivers, and addressing social determinants of health for older adults. And so these are everything we kind of hit on during our call. But keep an eye out. This request for proposal as a potential partnership will be coming out in June.
Wonderful. Thank you, Tim.
Oh, it is a pleasure to be a part of this. Yes.
Yeah. I'd like to thank all of our guest panelists for being on tonight's program. Eric Pad, who was unable to join us tonight, thank you for what you've done to start the Caregiver Incentive Project. Heather Peacott at Caregiver Incentive Project is the Grant and Development Advisor. Dr. Claire Luz, Director of Impart Alliance and College of Osteopathic Medicine at MSU. Shanae Krebs, Direct Care Worker in Private Duty, and Timothy Nyansenga, Senior Program Officer of Healthy Aging and Caregiving at the Michigan Health Endowment Fund. On a final note, I just want to make a little plug for next month's episode. We will be talking with MDHHS about the social determinant of health hubs that'll be created around the state. And happy to kind of announce, with Dr. Kelly Cam's permission, that Dr. Cam and I have both been accepted to be on the advisory council for MDHHS and the social determinant of health hubs. So excited to be UP voices representing our people here with something so important as social determinants of health. Thank you once again for joining us, and have a great evening.